Chris Carter here with you again. I want to talk to you about hypothyroid symptoms and the number one cause of hypothyroidism here in the U.S. Well, one thing that most patients have found out is they've struggled with these symptoms for a number of years. They have taken their medications faithfully, and they just really haven't made the results or gotten the results that they've thought they would get or hoped or even dreamt that they would get. Symptoms such as weight gain. No matter what you try to do, you can't lose a pound of weight. You eat less than anyone you know. You may or may not exercise, but the weight doesn't move. And if it does move, it moves the wrong way. Why is that? Well, there's a reason for that. Why are you always tired? Why are you fatigued? You don't have drive. You don't have the energy or get up and go. And it continually gets worse. Well, why is that? Why is your skin dry? Why does your hair fall out? Why do you have mental fogginess? Why do you have decreased libido? There are reasons for this, folks. And most likely, if you've been taking a levothyroxine, if you've taken Thyroid or Cymbalta or Armour for 1 year or more, and these symptoms are still there, then someone has really missed the boat what's going on with you. Most likely you have an autoimmune condition called Hashimoto's. Okay? Hashimoto's thyroiditis. It's an autoimmune disease, which means that it's your body attacking your body. Okay? And there are many other types of autoimmune diseases out there, but let's talk about Hashimoto's right now. If you have positive autoantibodies in your system for Hashimoto's thyroiditis, you will always, to some degree, have the symptoms associated with hypothyroidism, no matter what type of medication they try to give you. Because you see, if they're trying to fix your TSH, and you're all very familiar with TSH, that's what they try to keep in range. Well, your TSH is within range. We're not really sure why you feel the way you do. Let's give you an antidepressant, or let's give you this other medication. Well, folks, they're trying to chase the tail on this dog. Let's just find out what exactly is going on with you, because there is a core reason for these things happening. And there are very specific things that can be done to really take your symptoms from, say, an 8, 9, or a 10 down to a 1, 2, or a 3. And for most people, that is a huge life-changing turnaround. And that's what we do here at the office. It's about looking at a couple different things. It's not about getting tunnel vision and only looking at your TSH levels. If it's an autoimmune condition, I think it's pretty important to look at the immune system. How about the nervous system? Yeah, that's pretty important. Of course, we're going to look at the endocrine system and the thyroid, but it's this neuroimmune endocrine axis that we have to look at. There are 3 major components to getting you better with this. And if you've been somewhere that looks at one component and then only one small piece of that component, boy, you've really, for lack of a better saying, you've really been kind of shuffled under the rug with your symptoms. That's not what we want to do here. We want to look at the big picture, because it's a big picture that you have going on. And we got to find out what's going on here, specifically. How do we do that? We do that with very specific laboratory testing. We do specific testing that tests your immune system, your endocrine system, and we do very specific testing that tests your neurological system too. And we've got to find out where the missing links are. And then we've got to support those in an appropriate way. That's what really separates us from just giving medications to cover up symptoms. Because really our core philosophy is to find out the primary cause of your ailment, of your condition, of your chronic situation with your healthcare that you've been in. Not just to chase symptoms, okay? We all want to feel better. There's no doubt about that. And sometimes the medicines will help us with those symptoms. But hey, think about this. What if we find the underlying cause, we address those issues, and then start to work on that? What do you think is going to happen with the symptoms? Well, you know what's going to happen. They're going to go away, okay? And that is what we do that really separates us, that makes us different, okay? And I say different because I think we're different because we spend more time, and we're very thorough, and we do all the testing necessary to find out what's going on with you in your hypothyroid condition, okay? So if you're looking for someone who's really going to sit down with you, going to spend the time to find out what's going on, where you've been, what's worked, what hasn't worked, and then do all the appropriate testing, get the results back, and know what to do with the results. I want to repeat that. To know what to do with the results is very important. Then that's what we do here at the office. Okay, we work with folks with hypothyroid types of conditions all the time. basically several times a day, every day. But it's not just the endocrine system, it's not just the thyroid, folks. There's a lot more to this puzzle, okay? So please, whether it's me or someone else, get to someone who knows how to put all the pieces of the puzzle together. If you're simply frustrated with what's been going on with your treatment of your hypothyroid condition, go to our website, LouisvilleThyroid.com. You're going to find a lot of information there about us, about what we do, what makes us different, how we're successful, about me, and why what we do works. Okay, so check us out on the web at LouisvilleThyroid.com. That's LouisvilleThyroid.com. Again, I'm Dr. Chris Carter. Look for more videos, educational videos from me here on the web, and we want you to have a great day. Thank you very much.